It is a pleasure to see how 7th annual conference of the Indian Neurogastroenterology and Motility Association is being organized. I believe that such a meeting will lift the standard of care of the patients suffering from GI motility disorder and disorder of gut-brain interaction. The interest in this area of gastroenterology is increasing among students and the doctors, and I foresee lot more work on this disorder will come up in the country.
It gives me immense pleasure to let you know that this was a conference which was extremely successful. We had more than 700 registrations with faculties coming from all corners of the country and contributing their expertise to this one of a kind of event which was focused on neurogastroenterology and motility. We also had excellent international faculty who were top-notch and masters in their field. The delegates, they took active participation in the event throughout, from the first session to the last session, and we had excellent workshops which the people enjoyed to their very bit.
I'd like to congratulate the organizing committee. So I do think this venue is really fantastic, and obviously I can feel the vibes and also the educational content, very nice scientific program.
We are really excited to host the 7th conference of the Indian Neurogastroenterology and Motility Association. It is a proud privilege for us to have state-of-the-art lecture, debate and animated discussions by the who is who of motility disorder, not only in India but also throughout the international arena. I am really impressed with the over-enthusiastic support of all the delegates who have been actively participating and trying to learn the newer nuances of the motility disorders of the intestinal tract, which is so important in day-to-day practice of gastroenterology. And I think it is going to benefit not only all the new upcoming youngsters, but also it is a good learning exercise for most of us as practicing gastroenterologists.
This conference is said to be one of its kind, a unique one and an extraordinary one.
I would like to first congratulate Dr. Shrihari for organizing this 7th conference of our INMA in such a grand way. I think looking at the response we are having this time, it's a great success with more than 650 delegates. I think our society has come a long way from the first meeting which we had to the 7th meeting, and the numbers have grown, which shows that the content of our meetings is very good, it is very scientific, and it is most important, it's very useful for the physicians as well as the gastroenterologists, because it is dealing with topics which we see in our OPs daily. And as we are seeing so many patients in our OPD with these functional disorders, any meeting which focuses on this will help us to better improve our treatment for the patients and better the patient care.
The present decade has been phenomenal in the field of motility. Neuromotility and gastroenterology is a great field. We need to unravel the mystery of the puzzling problem which the patient undergoes. And many a times people used to be referred to the psychiatrist, and no more, believe me my friends. This conference of INMA is amazing, scientific content is brilliant, and I'm sure this will throw more light. And the neuromotility group used to be very small with very little attendance early on, but today, believe me, this conference has got 500 gastroenterologists participating and 200 physicians. So this is a prime area, because right from manometry, impedance paciometry to all the breath tests and the serological markers of IBS to the electrogastrography, we have amazing lot of gadgets and lot of info, lot of wisdom that you gain over a period of years from all the studies.
The success of any conference is guided by how much is the attendance of delegates and faculty, and I am very, very pleased. There are several people who are not getting even chairs to sit. The hall is absolutely jam-packed.